This is how you are greeted by the kids the moment you set foot on Dalori IDP camp and pull a camera to film. Authorities say the camp is home to no less than 28,000 displaced people, the bulk of them women and children. For at least a year now, this has become home to all those who fled their remote communities because of Boko Haram insurgents. Among the first settlers here is this man, who now doubles as the head of the IDPs. He said he fled his hometown of Bama early last year when Boko Haram overran the place. He's found a new home here and he says he is liking it.
We
thank the authorities for bringing us here, he says. We eat, we drink, we bath, we wash our clothes, we have a school, we have hospital, a special hospital built and run by the Air Force that treats us for free. The hospital is really a lifesaver. With guns hanging on their shoulders, Nigerian Air Force medical personnel attend to patients here at the hospital. So while they are fighting insurgents on one hand, they are also helping to save the lives of those who are caught up in the middle of the crisis. Even though it's an emergency medical facility, the hospital is still well stocked with drugs and some important medical equipment for handling more serious cases.
We've seen a spectrum of disorders, mostly diarrheal disease, diarrhea and vomiting among children, pneumonia, and of course we have a lot of aged IDPs here who have hypertension, diabetes, and a lot of people who have eye problems who could not see for about 20 years ago. And we undertook eye surgeries. We saw about 50 patients had eye surgeries and their sights were restored. So far we have about 130 people on the line for another round of eye surgeries.
Baba Gana Mohammed and her baby are sick, but mother and child are here for treatment. After an Air Force doctor attends to them, they are both admitted at the female ward of the hospital. They are both lucky because back in their remote village, she would not have had access to this kind of medical treatment. Thank God for this facility. I know my daughter and I will get better treatment and get well soon, she says. We have been here for 5 days now and we're getting better. Hundreds of IDPs like Baba Gana now throng the hospital, getting vital treatment to stay healthy.
Because of some other disorders, surgical disorders we've seen, the Chief of Air Staff decided to establish an operating theater equipped with ultra-modern equipment. He also employed the services of a gynecologist and a surgeon, general surgeon. Right now, we very soon will not be referring patients to any tertiary health center for secondary or even tertiary services.
The IDPs are no doubt enjoying the services of the hospital and other facilities available in the camp. But questions have been asked if they would enjoy all these services when they eventually return to their various communities.
There is going to be a post-insurgency phase to this. I believe the authority are also looking along that line, that by the time we believe that we put the challenge of insurgency behind us and the people are back in their community, of course there must be a post-insurgency phase to what you say that is happening here.
Until that time comes, for now, the IDPs are happy with what they are getting, and they are not showing any sign of being in a hurry to leave this camp. Deji Badmus, CCTV, Dalori, Maiduguri.